Fannie, thank you so much for joining me as we talk to leaders across Woodruff Health Sciences and Emory Healthcare. Fannie, tell us about yourself. Where did you grow up and how did you get here?
Well, it's been a long journey. I'm Fannie Harton, and I'm one of the specialty directors at Emory St. Joseph's Hospital. I manage about 6 or 7 different units, different specialties. I've been at St. Joseph's about 36, 37 years. I'm originally from Wichita, Kansas, so I'm a big Kansas KU fan. K-State also, just a little bit. This is my second career as a nurse. My initial career was as a respiratory therapist, and I worked in neonatal ICUs and high-risk teams. But I always wanted to be a nurse, and I did graduate from Georgia State University in 2004, I believe it was, as a nurse.
I could not think of a more laudable profession. I know you're a humble person, but I'm going to ask you, what's the one quality you think you have that brings to your leadership and makes you effective?
I think it's the fact that I love relationships and also compassion and empathy. I can actually put myself in some patient's shoes at times because I can remember my days as a patient, and it was long-term due to a motor vehicle accident.
Sorry about
and,
that.
And I will never forget those days or the people that helped me, and I was pretty helpless.
What's our special sauce here? What makes us special based on the kind of work we do and the specialties that you oversee? How do we differentiate ourselves at Emory Healthcare and at St. Joseph's?
I think it's the relationships that are built. There's a difference. There's a difference in Emory Healthcare and other organizations. And I would say the primary difference is the investment in people, the community, research, and each other.
Now, of course, we have amazing nurses at all of our sites. Do you think they differ in terms of the quality of nurses at each of these sites, the way we train nurses? Do we act as a system, in your opinion?
I believe that wherever the nurses come from, whether they be an Emory University nurse, which we love, or from one of our other wonderful colleges in Georgia or wherever, I believe that the foundation for training nurses at Emory Healthcare is different. It's systemized, it's strategic, it's thoughtful, and it's also based upon caring. We can teach people all the skills in the world, but what we can't do is teach them to care for people. And I think that's foundationally something that we look for in nurses. We look for nurses who care for people. If you don't like people, this is not the place for you to work.
Not the place.
No.
Nursing is an incredibly challenging profession. As you and I both know, after the pandemic, there was a significant stress on the profession, on healthcare in general. We're beginning to see more nurses staying and coming back. What have we been doing right about making sure that our nurses are taken care of?
I think the first thing that we did right is we didn't change. We had a pandemic, but we didn't quit caring for each other. We knew that we had a focus on caring for this new population of patients, but we still continued to care for each other and to uplift each other, and also to make sure that we were at the forefront of what's the best way to treat these patients, how do we do it? So I think that that says something itself for those who are watching us, and they're looking at us and they want to be like us. So I think that's an attraction for many nurses, is just the level of nursing and the level of care that Emory provides. I interview nurses all the time that say, I just want to work for Emory. And I think that that's a huge compliment, that just based on reputation, they want to work here.
5 or 10 years from now, what's going to remain the same about the nursing profession here at Emory Healthcare, and what's going to be different?
I believe the technology will definitely be different. I think it'll be better. I think it'll be faster. I think it will be something that increases patient satisfaction as well as staff satisfaction. But I also think the one thing that will remain the same is our relationships, our compassion, our staying true to the mission of caring for people and doing it the best anywhere in the world. So I think those things will remain the same, thankfully.
Yeah, I hope so. I hope so. My father was on dialysis for over 10 years, and if you asked him who his nurse was, he knew her name. If you asked him who his doctor was, he couldn't remember. And I'm a physician. So I certainly respected that, and it gave me a better and a much deeper appreciation for the profession as well. Terrific. Well, I could not be more thankful for your role at St. Joseph's and across Emory Healthcare, for the fact that you've been here as many years and still continue to be passionate, excited, energetic, as is obvious from this short interview. And I really appreciate all that you do here. Thank you very much.
Thank you very much. Appreciate it.
Great.